So next we are going to discuss hormones involved in human reproduction. During puberty, okay, puberty is the age when a girl or boy becomes sexually mature, reproductive hormones began to be released. These are called secondary sexual characters, which develops in men and women, eggs to mature into women. So it can develop in men and women. In women, the eggs are maturing in ovary. Okay. The main reproductive hormone is known as testosterone, produced by testes. It stimulates the sperm production. In female reproduction, it is known as estrogen, produced by ovary and produces physical changes and involved in menstrual cycle also. Okay, quite straightforward. Menstrual cycle is a process the body undergoes each month to prepare for a potential pregnancy. It begins with the lining of the uterus breaking down and woman has her period. The layer then builds up again until ovulation, which is day 14. A egg is released from the ovary, moves to the uterus via the fallopian tube. If fertilized egg not embedded in the lining, 28 days later, again it breaks down. Okay, so ovulation is concerned, 0 day the lining starts developing. 14th day lining is nicely developed. Ovary releases the egg. If fertilization is not happening, the whole layer will start degrading. 28th day everything will come out as a menstrual period. Okay, and the events of the cycle are controlled by 4 hormones. Follicle stimulating hormone causes maturation of the egg in the ovary within the structure called follicle. It's very self-explanatory. So the egg is present in a follicle. Since it helps in improvement or stimulating the follicle, it is known as follicle stimulating hormone. So its mainly work is in the first 14 days. Okay, and it stimulates the ovaries to produce estrogen, and it is produced in the pituitary gland. See, for sexual reproduction, again master gland is important. So thyroid stimulating hormone, adrenocortical stimulating hormone, testosterone, and ovary estrogen. So 4 follicle stimulating hormone. Everything is from the master gland. Okay, that's why we are doing Agna meditation. Okay, we are stimulating the pituitary gland. So estrogen causes the lining of the uterus to grow again, produced in the ovary. So estrogen is produced in the ovary, secretes as a result of the FSH indirectly. Okay, stimulates the production of the LH and inhibits the secretion of more FSH. So this FSH is a positive feedback to produce estrogen. If FSH increases, estrogen also increases. This is a positive feedback. We have studied negative feedback before. Now we are seeing the positive feedback. Luteinizing hormone is produced by the pituitary again. So follicular stimulating hormone and luteinizing hormone are from the pituitary. Estrogen is from the ovary. Similarly, from the ovary. Similarly, in a man, follicular stimulating hormone, luteinizing hormone from the pituitary, and testosterone is from a testis.
How do males don't have follicle?
They don't have, but it produces sperms. Follicles here produces follicle containing ovary. Here there is no follicle but produces sperms. That's it. Okay. And luteinizing hormone helps in production of the testosterone in men. Okay. So follicle stimulating hormone, luteinizing hormone is produced in pituitary. Is produced as a result of the hormone estrogen and results in ovulation. So luteinizing hormone results in ovulation. Okay. Progesterone is produced in ovary, secreted from the egg follicle, maintains the lining of uterus, supports the pregnancy if egg is fertilized, inhibits the release of both FSH and LH. So progesterone helps in maintaining the pregnancy. When you are maintaining pregnancy, we don't want follicle stimulating hormone and luteinizing hormone to produce follicles, ovum, etc. So progesterone inhibits the FSH and LH. So why estrogen stimulates while progesterone inhibits? You can easily understand it. Okay. So progesterone is for pregnancy, PP. Okay. Since progesterone helps in maintaining the pregnancy, it inhibits follicular stimulating hormone and luteinizing hormone. We don't want them. That's why periods won't happen during the full pregnancy. Okay. Only when you have periods, the follicular stimulating hormone, luteinizing hormone comes into play. Very easy to understand. Okay.
Wait, so you don't get a period for 9 months?
For 9 months.
Lucky.
But pregnancy is a challenge, no? Next is the contraception. So hormonal methods of contraception. So Contraception is a method by which man and woman can have sex without producing children, to avoid children. Okay, the contraceptive pill must be taken regularly or the body's own hormone will be released leading to egg maturation. So for a woman there is a contraceptive pill, so they have to take the tablet every day to make sure that the body's hormones are controlled. Since body hormones are controlled, the ovum is not released, so there is no pregnancy will happen. Okay, the mixed pill contains estrogen and progesterone. Okay, estrogen and progesterone both are there. This means estrogen levels are constantly high, inhibiting FSH, so no egg mature. See, FSH stimulation results in estrogen stimulation. If you're taking estrogen from outside, FSH won't stimulate. So only if FSH stimulates, we have the follicle will form, we have the ovum to form. So estrogen is maintained constant, which results in no FSH, no follicle, no ovum.
Yeah.
Okay. Now the lining also stops developing. The mucous cervix becomes thick, so sperm cannot move through. So the lining also is not developing in a good manner to receive the sperm. Some possible side effects are change of mood, mood swings, depression, breast pain, tenderness, breast enlargement, increased blood pressure. So these are all the side effects of the contraceptive pill because of the estrogen. The progesterone only pill has less side effects in compared to the mixed pill. Okay, so there are only two types of pills: mixed pills, estrogen and progesterone only pill. Estrogen has a lot of side effects, like for example mood swings, depression, breast pain, breast enlargement. So all these things are less in progesterone only pill. Okay,
We can go to the plastic IUD.
why contraceptive patch? Contraceptive patch whenever we can just finish it quickly. So contraceptive patch is the one, the same estrogen and progesterone are released by a patch in the skin instead of taking by mouth. Contraceptive implant is the one where there is an implant present, whether in the skin or in the ovum, whatever is that. Okay, so it's an implant. Contraceptive injection, it's a kind of an injection. It works for every second to third month. Okay, and last one is the plastic intrauterine device. It's the same effect as an implant, T-shaped one which is inserted into the uterus. So when it is inserted, it releases the hormones gradually. So there is no periods and no birth of the child. Okay. So these are all the hormonal methods. So various methods by which hormones are working. There are non-hormonal methods. These stop sperm fertilizing in the eggs. So by hormonal method, we control the release of the ovum. By non-hormonal methods, we are targeting the sperm because there is another culprit in producing the child. Okay, both of them only play together. So one is hormonal by controlling the ovum. The other culprit sperm is taken care by the non-hormonal method. For that we have spermicide. So spermicides are the chemicals which when used they will kill 70 to 80% of the sperms. The other one is condoms or diaphragms which protects by sperms not entering into the vagina. Condoms are either worn over the penis or inside the vagina. If it's inside the vagina, it's known as diaphragm. They also prevent the individual from contracting sexually transmitted disease like HIV, hepatitis, all the disease also is protected. And diaphragm is a plastic cup positioned over the cervix used with spermicide. Copper intrauterine device. So plastic intrauterine device, copper intrauterine device. The copper works by killing the sperm in the uterus, support and stopping any fertilized embryos from implanting. Copper is a foreign body. It produces a bad environment, so sperms won't work and the ovum won't implant. Copper intrauterine device. Another one with hormone is there. It is known as plastic intrauterine. It's a plastic one with hormone there. Surgical methods like male and female sterilization. So from the testes, there is a tube known as vas deferens. If you cut the vas deferens on both sides, sperm won't come out.
Isn't it just called the fallopian tube?
In women, it is known as fallopian tube. In women, it is fallopian tube, which we can cut.
A male is called sperm duct.
Sperm duct or vas deferens, both are sperm, both are same. The sperm duct's actual medical name is vas deferens. Okay, vas deferens, or just say vas. So abstaining from intercourse. If somebody is not having intercourse, so okay, again there won't be any communication with the egg and the sperm. Done. Okay, others may also abstain during ovulation. So during the ovulation on the 14th day, we can stop the intercourse. Now, how can you use hormones to treat infertility? So now we have used hormones to prevent childbirth. Now the other way, if somebody is infertile, if they are struggling to have a child, how you can use hormones to treat the infertility? So fertility drugs can be used to increase the chance of the pregnancy. The main hormones are FSH, LH. So previously we have given estrogen so that it blocks FSH. Now we are giving FSH itself on LH so that the chances of pregnancy is better. So there will be stimulation of the eggs and release of the eggs, and woman can then become pregnant normally. So in vitro fertilization is another treatment where a mother is given FSH-LH to encourage more egg production. The eggs are extracted from the mother and fertilized in the lab. It is known as test tube baby in common word. Okay, and the fertilized egg develops into embryos. Then one or two inserted back into the uterus. If two is inserted, that's why twins are produced. That's why in vitro fertilization, the chance of twins is more.
It's not twins, it's two different eggs and two different sperms.
At the end of the day, it's
So
known
they're
as
non-identical.
non-identical twins, or we can call it as a single embryonic twin or different embryonic twin.
How is it single? Because it's two embryos.
We can produce even from single embryo because in single ovum, outside when you are using the sperm, it can divide into two and both can become a baby. Anything is possible in the world. Okay. So benefits of the in vitro fertilization is a good way of infertile couple to have a child. The disadvantages or cons are it's physically very stressful for the woman. The hormones can cause reaction and he can feel sick. Emotionally, it is very stressful because instead of having a baby in your tummy, it's somewhere in a lab and you'll be always having your heart in the lab. Okay, it's very emotionally stressful period. It can lead to multiple births as we discussed now, like twins or quadruples, etc. And unexpectedly, it can risk babies to the mother. Can be very expensive procedure also. Okay. Negative feedback. As discussed earlier, negative feedback is the when body respond to an increase or decrease in a factor, returning back to its original level. If something is high, body does something to reduce it. If something is low, body acts on it to increase it. For example, thyroxine, we just discussed as an example. Thyroid produces thyroxine. It regulates metabolic activity and it also important in growth and development. Released by the thyroid gland. It is released stimulated by the thyroid stimulating hormone, which is from pituitary, master gland. So levels of thyroxines are controlled by negative feedback. What is mean by like if thyroxine levels are high, pituitary will secrete low thyroid stimulating hormone, so thyroxine will come down. If thyroxine levels are low, it will produce more thyroxine stimulating hormone, so thyroxine will go up. Okay, so it's very clearly this inhibits the release of thyroxine, so level falls. Same for adrenaline. Okay, adrenocortical tropic hormone. It is produced at times of stress, produces fight or flight response released by the adrenal gland. This is stimulated by fear or stress directed in the brain. Effects of adrenaline, it increases the heart rate, breathing rate, deliver more oxygen into the tissue. Glycogen stored in the liver is changed to glucose so that you have enough power to run. Okay, and pupils dilate. Why pupils dilate? So that you will get more light into the eyes so that you can see better. Oh, there is a tiger. Oh, there is an insect. Oh, there is a cockroach. So pupils dilate. Okay, and blood flow to the muscle is increased. Then only muscle can run for you. And blood flow to digestive system is decreased because we don't want somebody to digest at the time. So that's why if you are having a fear and stress, you will have indigestion.
Yeah.
That's why after food, you should have a relaxed sleep, not studying like this. Okay? Then only your digestion will be good. After food, nice relaxed nap. If you see a horrible movie after digestion, the blood will go to the brain, blood will go to the muscles, everything looks horrible, you will end up in indigestion.
Yeah.
Okay? Now,
Wait, 1 minute.
no. For a change, we are going to spend 2 minutes on plant hormones.